You woke up this morning with a scratchy throat and a dull headache, so you walked to the medicine cabinet, shook out a small white pill, and swallowed it without a second thought. 10 minutes later, you'd basically forgotten it happened. That pill contains something people 50,000 years ago would have handed over almost anything to have. Getting sick back then wasn't an inconvenience. It was often the beginning of the end, unless the people around you actually knew what to do. And what they knew is stranger, older, and far more sophisticated than anything you were taught in school. Here's the thing nobody tells you about ancient sickness. Survival wasn't random. It came down to whether your group had accumulated the right knowledge, passed down and tested over generations, long before anyone had a word for medicine. Start with something that sounds almost impossible. In 2017, a team excavating Shanidar Cave in northern Iraq uncovered evidence that rewrote what researchers thought they understood about Neanderthals, the close human relatives who lived across Europe and Asia until roughly 40,000 years ago. The original excavation, led by archaeologist Ralph Selecki back in the 1960s, had already produced something strange, a Neanderthal skeleton, catalogued as Shanidar 1, whose owner had survived catastrophic injuries, a crushed eye socket, a withered, partially amputated arm, damage to the leg that would have made walking without help nearly impossible. And yet the bones showed clear signs of healing, meaning this individual lived for years, sometimes estimated at a decade or more after the original trauma. An injury list like that doesn't heal itself. Someone fed this person. Someone helped them move. Someone kept them alive through an injury that, alone in the wild, should have been fatal within days. That's not an isolated case either. When Emma Pomeroy and a team from Cambridge returned to Shanidar Cave decades later, they uncovered another Neanderthal skeleton, Shanidar Z, and alongside it, clusters of ancient pollen and plant residue that reopened a decades-old debate about whether Neanderthals were deliberately burying their dead with flowers and medicinal herbs. The flower burial theory itself remains genuinely contested. Some researchers argue the pollen could have been introduced by burrowing insects rather than intentional ritual. But here's the thing. Nobody tells you about why that debate almost doesn't matter for the bigger picture. Even the more conservative interpretation of Shanidar Cave still shows something remarkable. A social group capable of sustained, coordinated care for an injured member over years. That's not instinct. That's organized survival medicine, running deep in our evolutionary history, long before anatomically modern humans even show up in the archaeological record. Now here's where it gets interesting, because Neanderthals weren't just caretakers. There's direct physical evidence they were also, in a real sense, pharmacists. Archaeologist Karen Hardy and her research team analyzed dental calculus, the hardened plaque preserved on ancient teeth, recovered from Neanderthal remains at El Cedron Cave in Spain. Trapped inside that calculus, they found microscopic starch granules and plant compounds, including chemical signatures consistent with chamomile and yarrow. Both plants have virtually no nutritional value. Chamomile tastes bitter. Yarrow tastes worse. The most plausible explanation Hardy's team proposed wasn't dietary, it was medicinal. These are exactly the plants a modern herbalist would still reach for to calm inflammation or treat a wound, and the individual whose teeth were analyzed appears to have been actively battling a dental abscess, a genuinely painful, potentially fatal infection if left untreated in a world with no antibiotics. So picture that moment. A Neanderthal in physical pain, deliberately choosing to chew on something bitter and nutritionally useless, purely because it made the pain and swelling more manageable. That's not blind instinct. That's applied, tested knowledge, and it means the story of humans treating illness with plants doesn't start with us. It starts before us. Here's the thing nobody tells you about how that knowledge actually got tested in the first place. Through an enormous, brutal amount of trial and error stretched out across thousands of generations, where the cost of getting it wrong was frequently death. Move forward roughly 45,000 years into the world of anatomically modern humans, and the evidence gets even more specific. In 1991, hikers in the Ötzi Alps stumbled onto a mummified body preserved in glacial ice for over 5,000 years. Researchers named him Ötzi. Alongside his tools, his clothing, and the arrow wound that eventually killed him, Ötzi was carrying something that initially puzzled scientists. 2 small leather pouches containing pieces of Piptoporus betulinus, commonly known as birch polypore, a bracket fungus that grows on birch trees. Birch polypore isn't food. It's tough, fibrous, and unpleasant to eat. But modern laboratory analysis has confirmed it contains compounds with genuine antibacterial and antiparasitic properties, and researchers studying Ötzi's remains found evidence of whipworm parasites in his digestive tract. The leading interpretation among the scientists who studied him is that Ötzi was carrying his own personal medicine kit, self-treating a known parasitic infection using a fungus whose properties he had almost certainly learned through observation or through knowledge passed down from people before him. A Bronze Age man, alone in the mountains, understood enough applied pharmacology to carry the correct remedy for a problem he couldn't see happening inside his own body. Now, here's where it gets genuinely strange, because ancient humans weren't just treating infection with plants. In some documented cases, they were performing actual surgery, and people were surviving it. Trepanation, the deliberate practice of cutting or scraping a hole into the human skull, shows up across the archaeological record on every inhabited continent, sometimes dating back over 7,000 years. It sounds like it should have been a death sentence. Bioarchaeologist John Verano, who has spent decades studying trepanned skulls recovered from ancient Peru, has documented something that initially surprises almost everyone who hears it: a remarkably high survival rate. Many of the skulls Verano examined show clear bone regrowth around the surgical opening, meaning the patient lived for months or years after the procedure, sometimes undergoing the surgery multiple separate times across their life. Nobody can say with total certainty why any individual procedure was performed. Some cases likely treated genuine head trauma, relieving pressure from skull fractures sustained in combat or accidents. Others may have addressed what ancient practitioners interpreted as illness located inside the head itself. But the survival rates alone tell you something important. This wasn't reckless mutilation. It was a refined, repeatable surgical procedure developed and improved through direct observation of which techniques kept patients alive and which ones didn't, executed with stone and obsidian tools, with no anesthesia beyond whatever the local pharmacology could provide and no understanding of germ theory at all. That's the wild part. These healers had no idea what a bacterial infection actually was, and yet across multiple, completely unrelated ancient cultures, they had already worked out that keeping a wound clean mattered. There's an even stranger wound treatment that shows up independently across cultures with no contact with each other: maggots. Traditional healers among Maya communities in Central America, or Seminoles, and separately Aboriginal Australian communities documented deliberately allowing fly larvae to colonize badly infected wounds. To outside observers, centuries later, this looked like the opposite of medicine. It's actually the opposite of that. Maggots consume dead, infected tissue while leaving healthy tissue alone, and in the process they secrete compounds that suppress bacterial growth. Military surgeons rediscovered the same principle independently during the First World War, after noticing that wounded soldiers whose injuries had been colonized by maggots in the field sometimes healed cleaner than soldiers who received immediate medical attention. It became a formally recognized treatment, and versions of medicinal maggot therapy are still used in modern hospitals today, for exactly the same reason ancient healers on two separate continents figured out independently. It works, whether or not you understand why. Here's the thing: nobody tells you about the substance ancient people used most consistently for exactly that purpose: honey. The Ebers Papyrus, an Egyptian medical text dating to roughly 1550 BCE, contains dozens of documented wound treatment recipes built around honey, often combined with grease and plant fiber, applied directly to cuts, burns, and infections. For centuries, this looked to modern historians like pure superstition. Then, researchers, including microbiologist Peter Molin at the University of Waikato, began systematically testing honey's actual antibacterial properties in a lab setting. What they found is that honey genuinely does inhibit bacterial growth through a combination of low moisture content that starves bacteria of water, natural acidity, and an enzyme bees introduced during production that slowly generates hydrogen peroxide directly inside the honey itself. Ancient Egyptian physicians didn't understand the chemistry. They didn't need to. They just noticed over centuries of accumulated observation that wounds packed with honey healed better and got infected less often than wounds left untreated. And they built an entire treatment protocol around a result they could see without ever knowing why it worked. The same pattern shows up again with a completely different plant, one whose active compound eventually became the pill sitting in your medicine cabinet right now. Willow bark contains a chemical compound called salicin, and physicians in ancient Sumer, Egypt, and later Greece all independently documented chewing or brewing willow bark to treat pain, inflammation, and fever. The Ebers Papyrus references it. So does the later work attributed to Hippocrates. Nobody in the ancient world could isolate salicin, let alone explain how it worked at a molecular level. It took until the 19th century for chemists to purify the compound, and a bit longer after that for the pharmaceutical company Bayer to synthesize a more stable version of it in a form we now call aspirin. Here's the thing nobody tells you about that pill you took this morning. It isn't a modern invention that replaced ancient medicine. It's the direct chemical descendant of a remedy people were already using and already trusting for well over 3,000 years before anyone understood why it worked. That's not even the most advanced medical concept ancient people managed to work out without modern science. Centuries before Edward Jenner is credited with inventing vaccination in 1796, physicians in China and India were already practicing a technique called variolation. Historical medical texts describe deliberately exposing a healthy person to material taken from a mild smallpox case, sometimes by blowing dried, powdered scab material into the nostril, sometimes by introducing it through a small cut in the skin. Chinese medical writing describing the practice dates back at least to the 16th century, and oral traditions among practitioners suggest it may be considerably older than that. Variolation carried real risk. A percentage of people who underwent it developed full-blown smallpox and died. But the statistics, tracked informally by practitioners over generations, consistently showed that deliberately induced mild cases produced far lower mortality than catching smallpox naturally, and that survivors gained lasting immunity. That is, functionally, the core logic of vaccination. Controlled exposure now to prevent catastrophic exposure later. Ancient physicians didn't know what an immune system was. They didn't know antibodies existed. They just tracked outcomes carefully enough across enough patients to notice the pattern and build a working medical practice around it, centuries before Western medicine caught up. So if plants, surgery, and early immunology only got you so far, what happened when the threat wasn't a wound or an infection, but something that could tear through an entire group at once? Now here's where it gets interesting again, because ancient people also appear to have understood something we now call epidemiology, decades or even centuries before the word existed. Historical and archaeological evidence from multiple ancient societies, including early Mesopotamian and biblical-era texts describing skin disease, documents deliberate isolation practices, removing visibly sick individuals from the rest of the group, restricting their movement, and controlling contact until symptoms resolved or the person died. Nobody understood the concept of a pathogen, but they had clearly noticed through repeated painful experience that illness seemed to spread from person to person and that separating the sick from the healthy reduced how many people ultimately got sick. That's not a formal scientific theory. It's applied statistical observation, refined the same brutal way everything else in ancient medicine was refined, by watching what happened when groups did it and what happened when they didn't, and remembering the difference. That observation eventually hardened into formal policy. During recurring plague outbreaks in the 14th century, officials in the Venetian port city of Ragusa, and later Venice itself, began requiring incoming ships to anchor offshore and wait before anyone was allowed to disembark. The waiting period, eventually standardized at 40 days, gave the practice its name, quarantina, the root of the modern word quarantine. City officials at the time had no theory of germs, no microscope, nothing resembling modern epidemiology. What they had was a body count and a repeated pattern connecting new arrivals to new outbreaks, and they built an entire enforced maritime policy around a correlation they couldn't scientifically explain but could no longer ignore. Sickness didn't only threaten the individual either. It threatened the next generation directly, and ancient communities appear to have developed a specialized body of knowledge specifically around that risk. Archaeological evidence recovered from burial sites across multiple ancient cultures, including specialized birthing tools and grave goods associated with women who died during or shortly after childbirth, points toward dedicated midwifery knowledge passed down largely among women, generation to generation, often entirely outside the written record. Ethnobotanical research cataloging traditional birth practices across surviving indigenous cultures has documented specific plants used consistently to manage bleeding, ease labor, and treat postpartum infection. Remedies that, when tested in modern pharmacological studies, frequently show measurable, real physiological effects. Childbirth was, for most of human history, one of the leading causes of death for women of reproductive age. The fact that humans survived it in large enough numbers to keep populations growing at all points toward exactly the same pattern as everything else in this story. Specialized, tested, carefully guarded knowledge, refined over an almost incomprehensible number of generations. Here's the thing nobody tells you about how all of this knowledge actually survived long enough to matter, because none of it was written down for most of human history. It moved from person to person, generation to generation, entirely through direct teaching and memory. Anthropological research studying present-day hunter-gatherer societies, including long-term ethnobotanical fieldwork among Amazonian and African forager communities, has documented individual groups maintaining working medicinal knowledge of literally hundreds of distinct plant species, each one tied to a specific ailment, preparation method, and dosage. That kind of knowledge base doesn't appear overnight. Researchers studying oral knowledge transmission estimate it likely takes many generations of careful teaching, correction, and first-hand testing to build and preserve a pharmacopoeia that detailed, which means the healer treating a fever in a Neolithic village wasn't improvising. She was drawing on a body of tested, curated knowledge that may have already been centuries old by the time it reached her. None of this knowledge stayed confined to one region either. It hardened independently and in parallel into entire formal medical systems on opposite sides of the planet. In ancient China, practitioners developed what would become traditional Chinese medicine, a structured system of diagnosis and herbal treatment with written roots extending back well over 2,000 years, built through centuries of documented trial, observation, and refinement across a vast population. In India, a parallel system called Ayurveda developed its own detailed pharmacopoeia, its own surgical techniques, and its own theories of disease, codified in texts like the Sushruta Samhita, which describes surgical procedures, including early forms of cataract surgery and plastic reconstruction, that wouldn't be matched in European medicine for well over 1,000 years. Neither system had contact with the other when these traditions began forming. Both arrived independently at the same underlying method. Watch what happens to sick people, keep track of what helps and what doesn't, write it down once writing exists, and keep refining it for as long as the civilization survives. That's not superstition converging by coincidence. That's the same scientific process modern medicine still runs on today, just operating over a far longer timescale, without laboratories, and without the word science to describe what it was actually doing. Put all of this together, and a very different picture of ancient medicine starts to come into focus. Neanderthals caring for a severely disabled member of their group for years, dental calculus preserving direct physical evidence of deliberate herbal treatment, a Bronze Age traveler carrying his own targeted antiparasitic fungus, skulls showing successful, repeatable brain surgery performed with stone tools, wound treatments built around a substance we can now prove genuinely kills bacteria, a pain reliever that eventually became one of the most widely used pharmaceuticals on Earth, and a working, if unspoken, understanding that disease spreads and that isolation slows it down. None of that fits the image most people carry around of ancient sickness, the one where our ancestors were simply helpless, waiting to die of anything more serious than a scraped knee. The real picture is closer to an unbroken, tens of thousands of years long research project, conducted without laboratories, without written records for most of its duration, and without any formal understanding of biology, chemistry, or germ theory. Just relentless observation, passed down and refined by people who had every reason to get it right, because getting it wrong meant losing someone they depended on to survive. So the next time you feel that same scratchy throat and you reach for that same small white pill, it's worth remembering what it actually represents. Not a clean break from some superstitious, helpless past, a direct continuation of it. Somewhere underneath the coding and the manufacturing and the clinical trials is the same compound a Sumerian healer was already trusting, for reasons she couldn't fully explain, thousands of years before anyone learned to explain it at all. You're not swallowing something new. You're swallowing the end result of the oldest ongoing experiment humans have ever run on themselves, and it's still running right now every single time someone gets sick and someone else decides to help.